Hi everyone, everything. It's me, Ivan Alas, and I am going to share about obstetric medications, which are the progestin that is used in normal pregnancy and captopril, which is used in high-risk pregnancy. So, what are we waiting for? Let's start.
What is progestin medication in pregnancy? It is a synthetic form of progesterone are often used during pregnancy to support early gestation and reduce the risk of miscarriage, particularly in women with a history of recurrent miscarriage or early pregnancy bleeding. It functions by promoting uterine lining development and maintaining pregnancy stability. It generally considered safe for both the mother and fetus when prescribed by a health care provider. Progestin medications are classified into several categories based on their chemical structure and properties. The main classifications include 1. Progesterone derivatives includes dihydrogesterone and medrogestone. 2. 17-alpha hydroxyprogesterone derivatives such as medroxyprogesterone acetate and chlormadinone acetate. 3. 19-norprogesterone derivatives includes norethisterone, levonorgestrel, and desogestrel. 4. Spironolactone derivatives like drospirenone. Each class interacts differently with hormone receptors, affecting their therapeutic applications and side effects. Mechanism of action: uterine effects. They transform the endometrium from a proliferative to a secretory phase, preparing it for potential implantation of a fertilized egg. Inhibition of ovulation. Progestin suppress gonadotropin release, inhibiting ovulation and preventing fertilization. Cervical mucus thickening. They thicken cervical mucus, making it less penetrable by sperm. Endometrial stability. Progestins counteract estrogen's proliferative effects on the endometrium, reducing the risk of hyperplasia and cancer. Common side effects include headaches, breast tenderness, diarrhea, nausea, vomiting, and mood changes. Serious side effects: blood clots, heart attack, stroke, and allergic reactions are hives, difficulty of breathing or DOB, swelling of the face or throat. Contraindications: allergy or sensitivity. Avoid if allergic to progestins. History of certain cancers, particularly breast or genital cancers. Liver disease. Liver impairment can exacerbate side effects. Unexplained vaginal bleeding should be evaluated by a doctor first. Recent stroke or heart attack. Increased risk of cardiovascular events. Blood clotting disorder, where history of blood clots heightens risk. Note: caution is advised for those with heart disease, migraines, asthma, kidney issues, or depression. Management. Number 1. Dosage and administration. Follow your healthcare provider's instruction regarding dosage and timing. Progestin should be taken consistently at the time each day to maintain stable hormone levels and minimize side effects. 2. Missed doses. If you miss a dose, take it as soon as you remember unless it's close to the next dose. In that case, skip the next dose and resume your regular schedule. Do not double up. Number 3. Monitoring. Regular checkups are essential, especially for a long-term use. Discuss any side effects or concerns with your doctor. 4. Storage. Store progestin medications at room temperature, away from moisture and light, and keep them out of reach of children. 5. Combination therapy. If using with other medications, ensure proper timing and avoid mixing without guidance from your healthcare provider.
We're done with progestin. So, let's talk about captopril.
What is captopril medication in pregnancy? It is marketed as Capoten, is an angiotensin-converting enzyme or ACE inhibitor used primarily to treat hypertension and congestive heart failure. It helps improve survival rates post-myocardial infarction and is effective in managing diabetic nephropathy in type 1 diabetes patients. It works by inhibiting the conversion of angiotensin 1 to angiotensin 2. Captopril promotes vasodilation, reducing blood pressure and cardiac workload. Mechanism of action. It involves the inhibition of angiotensin converting enzyme or ACE, which converts angiotensin 1 to angiotensin 2. By blocking this conversion, captopril reduces levels of angiotensin 2, a potent vasoconstrictor that raises blood pressure and stimulates aldosterone secretion, leading to sodium and water retention. This results in vasodilation, decreased blood pressure, and improved cardiac output. Additionally, captopril increases bradykinin levels, further promoting vasodilation. Overall, these effects make it effective for treating hypertension and heart failure. Common side effects: low blood pressure or hypotension, skin rash, altered taste sensation, dry cough. Serious side effects includes angioedema, swelling of the face, lips, tongue, or throat, neutropenia or low white blood cell count, hyperkalemia or high potassium levels, kidney damage or reduced urine output or swelling, liver damage, nausea, and jaundice. Contraindications: hypersensitivity to captopril or other ACE inhibitors, anuria or absence of urine production, history of angioedema related to previous ACE inhibitor use, bilateral renal artery stenosis or narrowing of arteries supplying both kidneys. Pregnancy, particularly in the second or third trimesters, due to risk of fetal injury or death. Concurrent use of aliskiren in patients with diabetes or renal impairment. Management, monitoring, regularly check blood pressure and renal function. 2. Monitor electrolytes, particularly potassium. Patient education. Advise taking on an empty stomach and report any signs of side effects like cough or swelling.
We're done talking about these two obstetric medications, which is the progestin and captopril. This video is presented to Mr. Reginald John J. Ravello, an RN, and presented by Ivan Alice. Thank you for watching!